Do you know what a stroke is and how it can affect you? A stroke, often referred to as a brain attack, is a grave medical emergency. It happens when the blood flow to your brain is interrupted or reduced, depriving your brain cells of vital oxygen and nutrients. Without swift intervention, a stroke can cause severe brain damage, long-term disability, or even death. Hence, understanding stroke is not just important, it's crucial. Over the next few minutes, we'll be delving into the intricate world of strokes. We'll shed light on the different types of strokes, what causes them, and the risk factors that increase their likelihood. We'll also cover how to recognize the symptoms of a stroke, how it is diagnosed, the available treatment options, and most importantly, how to prevent it. In the next few minutes, we will delve deeper into the types, causes, symptoms, diagnosis, treatment, and prevention of stroke. There are three main types of stroke, each with its own causes and effects. The first type is an ischemic stroke, which happens when a blood clot blocks or narrows an artery supplying blood to the brain. This type of stroke is the most common, accounting for approximately 87% of all cases. There are two subtypes of ischemic stroke, thrombotic and embolic. Thrombotic strokes occur when a blood clot forms within one of the brain's arteries. Embolic strokes, on the other hand, occur when a blood clot or other debris forms elsewhere in the body, usually the heart, and travels to the brain, blocking a blood vessel. The second type is a hemorrhagic stroke, which occurs when a weakened blood vessel ruptures and bleeds into the surrounding brain tissue. These strokes can be further divided into intracerebral hemorrhages, which occur within the brain tissue, and subarachnoid hemorrhages, which occur in the space between the brain and the surrounding membranes. The third type is a transient ischemic attack, or TIA, often referred to as a mini-stroke. TIAs are temporary episodes of stroke-like symptoms caused by a brief decrease in blood supply to a part of the brain. While TIAs typically last only a few minutes to a few hours and do not cause permanent brain damage, they are often a warning sign of an impending stroke and should be taken very seriously. Each of these types of stroke has distinct causes and effects, and understanding the differences between them is crucial for recognizing the signs of a stroke and seeking appropriate medical attention. Keep in mind, the faster a stroke is diagnosed and treated, the better the chances are of minimizing brain damage, disability, and even death. So now that you're familiar with the different types of stroke, you're better equipped to recognize one if it happens. Remember, time is of the essence when it comes to stroke, and every second counts. Understanding these types can help you recognize a stroke when it happens. There are several factors that increase the risk of stroke. First up, high blood pressure, also known as hypertension. It's the leading cause of stroke and the most significant risk factor. When your blood pressure is too high, it puts extra strain on your blood vessels, including those that supply blood to your brain. Over time, this can lead to damage and increase the likelihood of a stroke. Next, we have smoking. The toxins found in tobacco smoke can damage your blood vessels, leading to blockages and increasing your risk of stroke. If you're a smoker, quitting is one of the best things you can do for your health. Diabetes is another key player. Individuals with this condition are at a higher risk of developing cardiovascular diseases, including stroke. This is because high blood sugar levels can damage blood vessels, making a stroke more likely. And then there's high cholesterol. When you have too much cholesterol in your blood, it can stick to the walls of your arteries, forming a thick, hard deposit called plaque. This makes your arteries narrower, restricting blood flow and increasing the risk of clots that can lead to a stroke. Obesity is another significant risk factor. Being overweight can increase the likelihood of developing other stroke risk factors like high blood pressure and diabetes. Regular physical activity can help manage your weight and reduce these risks. Family history also plays a part. If a close relative, like a parent, sibling, or the child, has had a stroke, your risk may be higher. Age is another key factor. The risk of stroke doubles with each decade after the age of 55. But remember, a stroke can happen at any age. Finally, let's talk about gender. Men are at slightly higher risk of stroke than women, although women have a higher lifetime risk due to a longer life expectancy. By managing these risk factors, you can significantly reduce your chances of having a stroke. Remember, prevention is the most effective treatment. Through lifestyle changes and, in some cases, medication, you can greatly reduce your risk and protect your brain health. Recognizing the signs of stroke and seeking immediate medical attention is crucial. When a stroke strikes, it's like a clock starts ticking, and every second counts. The most common symptoms of stroke can be remembered with the acronym FAST-F, stands for face. Is one side of the face drooping? Does it feel numb? A stands for arms. Is there weakness or numbness in one arm? S stands for speech. Is speech slurred or hard to understand? And T stands for time. Time to call emergency services if you notice any of these symptoms. But there are other signs as well. You might experience sudden confusion or trouble understanding speech. You could have trouble seeing in one or both eyes, or have difficulty walking, dizziness, or loss of balance. A sudden severe headache with no known cause is another warning sign. Remember, time is brain. The faster you recognize these symptoms and get medical help, the better chance you have of minimizing damage. If you or someone else shows symptoms of a stroke, it's important to seek medical attention immediately. Diagnosing a stroke promptly is crucial to minimize damage and improve the chances of recovery. The diagnosis process usually begins with a physical examination and a review of medical history. A healthcare provider will also conduct neurological tests to assess your vision, balance, coordination, and strength. Imaging tests are the cornerstone of stroke diagnosis. A computed tomography or CT scan can quickly visualize the brain and show hemorrhages, tumors, strokes, and other conditions. An MRI or magnetic resonance imaging can detect brain tissue damaged by an ischemic stroke and brain hemorrhages. In some cases, other tests might be used. Carotid ultrasound can show the presence of clots or plaque buildup in the carotid arteries. A cerebral angiogram can provide a detailed view of the arteries in your brain and neck. Once a stroke is diagnosed, treatment begins immediately, and the approach depends on the type of stroke. Ischemic strokes, caused by clots obstructing blood flow to the brain, are often treated with medications that can dissolve the clot or prevent others from forming. Sometimes a procedure called a thrombectomy is performed to remove the clot directly. Hemorrhagic strokes, caused by bleeding into or around the brain, require different treatment. This might include surgery to repair blood vessel abnormalities and reduce the risk of further bleeding. Medications to control blood pressure, reduce brain swelling, and slow bleeding might also be used. Rehabilitation is a critical part of recovery after a stroke. This might involve working with physical therapists to regain strength and coordination, occupational therapists to relearn everyday activities, and speech therapists to address problems with speaking or swallowing. It's important to remember that every stroke is unique, so treatment and recovery will vary for each person. However, the earlier a stroke is recognized and treated, the better the chances of recovery. Remember, early diagnosis and treatment can significantly improve outcomes. While some risk factors for stroke can't be controlled, there are many things you can do to lower your risk. Adopting healthy lifestyle habits is one of the most effective ways to prevent a stroke. This includes eating a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and low-fat dairy. Regular physical activity is also crucial. Aim for at least 30 minutes of moderate intensity exercise on most days of the week. If you smoke, quitting is the best thing you can do for your health. Limiting alcohol consumption can also lower your risk. In addition to lifestyle changes, managing medical conditions is key. Regular checkups can help detect high blood pressure, high cholesterol, and diabetes early. If you have any of these conditions, it's important to follow your doctor's treatment plan carefully. Certain medications can also help prevent strokes in people at high risk. Remember, prevention is the best medicine. That's a lot of information to take in, so let's quickly summarize what we've learned. Stroke, often referred to as a brain attack, can be categorized into three main types: ischemic, hemorrhagic, and transient ischemic attack. These occur due to blood clots or ruptured blood vessels, depriving the brain of essential nutrients and oxygen. Various risk factors can increase the likelihood of stroke, including hypertension, smoking, diabetes, high cholesterol, obesity, physical inactivity, family history, age, and gender. Symptoms may include sudden numbness, confusion, vision problems, difficulty walking, and severe headaches. Prompt recognition and treatment can significantly improve the prognosis. Prevention strategies include managing risk factors, maintaining a healthy lifestyle, and staying informed. With this knowledge, you are now better equipped to recognize, respond to, and prevent stroke. Remember, every second counts. Stay informed, stay healthy, and be proactive in your health.